What percentage of multiple myelomas are light chain myeloma?
So out of all the myelomas that are light chain secretory only, that's about 20%. So the other 80% have a monoclonal protein. Now, out of the myelomas who have a monoclonal protein, probably 90% of those cases also overproduce light chains. So light chains are very, very commonly overproduced, and they are clinically very important because they can cause, for example, acute kidney failure.
Yeah, yes. About my particular patient, is there anything in the epidemiology or the description I gave you of that patient that would make you lean that he could be at higher risk? Let's talk about some of the epidemiologic factors that I mentioned. His race is an example, where he grew up, or are there factors that predict multiple myeloma?
So what causes myeloma? That's a good question. I think, unfortunately, similar to most other malignant disorders, we don't entirely know what the cause is. And we unfortunately don't know for the individual patient. But in the population, we know that individuals with an African American descent has about 2 times higher prevalence, higher incidence of onset of disease. We also know that individuals with an African American descent has about a 10-year earlier age of onset. So I think that's clinically important to know. So we are, as doctors, trained to look for different patterns of symptoms. So a younger African American patient can actually have myeloma even if you think it's a young person.
Yes. That's an interesting point.
Also, you mentioned your patient had been active during the Vietnam War, and I think you mentioned Agent Orange. So that's something we published a study in 2015 showing that servicemen who are exposed to Agent Orange have about a 2-fold higher risk for developing monoclonal gammopathy or MGUS or light chain MGUS compared to the general population. So Agent Orange is also a risk factor.
Was that only applied to servicemen exposed to Agent Orange or to all people who served?
So this was found in servicemen who did apply. And we did a so-called nested case control study with almost 1,000 servicemen. So around 500 were people who did spray Agent Orange, and the other 500 were people who served for the Air Force during the same exact years in Southeast Asia, but were not exposed to Agent Orange. So it's a very well-controlled study, and it's published in JAMA Oncology 2015.
Yeah, I've read that. What about where he was raised? Are there geographic risk factors associated with multiple myeloma?
So at this point, it's a little bit less clear, but if you look in the NCI SEER database for the statistics of multiple myeloma, you can see that there is probably up to 50% higher risk in the population in the Midwest. And there is also indication from the National Cancer Institute's so-called Ag Health Study, Agricultural Health Study, where they have looked into farmers who do pesticide application, that there is also an increased risk. So there probably are, but this is something that we know a little bit less about. There is a lot of work going on in this field.
Yeah. And age, does age play a role?
Age plays a huge role.
Yeah.
The age of onset for multiple myeloma, the average age is actually around 70. If you start looking into details, you will see that about half of all newly diagnosed myeloma patients are diagnosed from 70 and up, and the other half is about 50 and up. But that's almost true. There is also a group of people diagnosed below the age of 50, and they represent about 5% of all the cases. I have cases in their 20s and 30s and 40s, but they population-wise are rare, but a specialized center like where I do work, we have a lot of those cases.
How common is multiple myeloma in terms of cancers? How does it fit?
Multiple myeloma is viewed as a rare cancer, and that refers to the incidence, number of cases newly diagnosed every year. Around 30,000 cases in the United States. Worldwide, around 120,000 new cases. But if you look in America, the prevalence is skyrocketing. And this is a consequence of all the new treatments we have. Patients are living longer and longer, but still we don't have a cure. When I started off treating patients, the average survival, unfortunately, was only 1, 2, or 3 years. Yeah. Now patients live 10, 20 years. Yeah. So in America right now, there are 30,000 newly diagnosed every year, but the prevalence is around 120, 130,000. So these are people living with the disease, and that number just increases every year. Every month it goes up.
Yeah, that's great. That's actually quite good. Yes. And what percentage of those patients relapse ultimately?
So at this time, unfortunately, the majority of all patients diagnosed will relapse once they have a diagnosis of multiple myeloma, because there is no curative treatment. But we are working on that. And if you follow patients over a long time, there are patients where the disease doesn't seem to come back. I can also share with you from my clinic, we have more than 30 open clinical trials, and we have very much focus on new drug development, but also early initiation of therapy in the newly diagnosed setting and what's referred to as higher risk smoldering categories. So in the newly diagnosed setting, we have a large proportion of patients who are minimal residual disease negative or MRD negative for 5 years. Yeah. So we have a lot of those patients. So 10 years from now, we may see that there could be patients where the disease never came back. So this is very exciting.